Executive Director of the Institute of Global Homelessness. We are based at DePaul University in Chicago, Illinois. We are so thrilled to have you here today and to be talking about the very first issue of the International Journal on Homelessness, which we were pleased to be one of the founding partners of. So IGH has 3 different strategic priorities. We use the tagline, see it, solve it, share it, to describe what it is that we do. In the see it bucket, we focus on international advocacy, primarily at the United Nations level, to work to get more countries defining and measuring homelessness so that we can know the scope of the problem around the world that we're trying to solve. In the second bucket of work, we have our Vanguard cities, where we partner with 13 different international communities that have all set a particular goal in addressing homelessness, and we come alongside them to support them and to help connect them to different resources and experts to help them achieve those goals. And then finally, our last bucket of work is around sharing it. What is working around the world? What are we learning? How can we learn from each other? And so we really see the International Journal on Homelessness as really fitting into that share it bucket. And so that's one reason we're so thrilled to be part of the International Journal and thrilled to have you with us today to talk about some of the really interesting and unique research and perspectives that are brought forward by this journal. So I'm really pleased to be able to hand over the conversation now to Abe Oudshoorn, who is the fearless managing editor of the journal. So again, thank you, everyone. We look forward to a wonderful conversation. And Abe, over to you.
Well, good morning, everyone. And thank you, Lydia, for welcoming us. And thank you, everyone, for joining from whatever time zone you happen to be in as well. So I know for some folks I see from out west that you're up very early to be with us, and I see some folks from the other side of the world as well who are up very late. So great to have you all gathered here today. So my name's Abe. I'm associate professor in the School of Nursing at Western University. And as Lydia mentioned, I have the privilege of being the managing editor for the journal. And it's been just an incredible couple of years as we've been getting this all together, from the inception of the idea to pulling together an incredible international board and receiving our first submissions, hard at work in getting those reviewed and edited and then finally getting those out. And so, well, it's been a million miles an hour from our end of things. Over the last few days, I've really had the opportunity to kind of take a step back again and think about kind of what motivated us to do this and what brought us all together in creating this journal. Because as we all know, academic life is busy enough with the responsibilities that why would we, put extra time into doing something else? And for me, it really brought me back to thinking about homelessness and what we are all driven by. And I think our common driver is a belief that homelessness is a preventable and solvable problem. When I think about my time working as a nurse at street level with people experiencing homelessness, I loved the work. It was just so challenging and fulfilling and interesting and frustrating. And part of the frustration that I lived while I was working frontline was feeling that the systems were failing and that I, as a nurse, was simply putting band-aids on much larger problems. And I wasn't really solving anything. I was helping keep people safe and keep people alive, but I wasn't changing the story of homelessness. And so that's what brought me and drew me into academia and thinking about creating knowledge that will change policies and change programs and really change the situation so that everyone can find home. And so in doing that, I had a belief. I had a belief that we could fix homelessness. And at the time, that was just in my own city of London, Ontario, Canada. But, has grown to see that we can solve homelessness in our province. We can solve homelessness in our country. And I believe we can solve homelessness around the world. And that is a huge motivator for us as a new journal, is that we believe that we can do better, and that in each of our countries we can do better, and internationally we can do better, that everyone has a right to housing. And so we need to figure out how to actualize that, how to keep people housed, how to get people housed. And so in a way, homelessness is both a very complex and a very simple challenge. It's complex because individuals are complex and the issues that lead to the crises in their lives are complex. And countries are complex. The economics in different countries, the social factors, the politics of different countries make it complicated to ensure that everyone has a safe place to live. On the other hand, it's very simple. Homelessness is the lack of a home, and you solve it by providing folks somewhere to be. And for those who need it, you provide the supports so that they can access that housing and they can stay in that housing. So we hope to bridge both the complexity and the simplicity. By that, I mean, we hope to help find those solutions that everyone will have a home. And to do that, we hope to share all of the incredible knowledge that is being produced around the world. And it's really that around the world part that has been such a driver for us to do this journal, because I want to absolutely acknowledge and credit the incredible journals that are already out there, the journals that all of us have published in along the way, and will continue to publish in as well. However, where we saw a real need was to have an intentionally international lens. So it's no surprise that the high income world dominates the academic discussion in terms of who is writing the papers, who's getting published, and whose work is getting shared. There's this huge privileging of knowledge that's North American, that's European, that's Australian. And so we saw a real opportunity not only to create a venue to share that work as well, but to be very intentional about sharing work from the rest of the world and really making academic space for middle and low income countries to participate in sharing their wisdom and their solutions. And so that has been why we went with an international journal. And that has had some incredible opportunities. I've met already so many wonderful people from around the world who've come on our board and who have submitted your articles to our journal. But of course, it comes with challenges as
Claro que
well.
también vienen con retos. Una de las cosas que necesitamos que hacer es asegurarnos que la revista fuera completamente gratis y abierta con acceso. Y claro, hay costos detrás.
All happen. And so I just want to give huge thanks to two organizations. One is to Lydia and the Institute of Global Homelessness, because they provided financial support, they provided backbone support, such as putting together this webinar for us. Our social media sharing, thank you, Tiffany, for that. So incredible support from IGH. And then secondly, Western libraries. So for all of you who've submitted articles or who have been reviewers on articles, that whole system that you interact with is backboned by Western University, where I am, our library program. And in terms of just having a platform for the journal to live on that is free for us. So those are awesome things that make this a possibility. And then the other thing that was a huge value for us was the opportunity for folks to submit articles in their language of study, and for that article to go through the review process in that language. And then we would do a translation at the end in order to post the article in both the primary language and in English. Again, that has had a lot of incredible efforts and challenges, and huge thanks to our editors and reviewers. As particularly, we've received a lot of Spanish language submissions, and they've been doing an incredible job for us. So thank you for that. But for us, this is worth it, right? This is the effort that we need to make in order to make sure that everyone has a voice in the solutions to homelessness. So it's been, like I said, it's been a million miles an hour, but it has really, reminded me of why we're doing all of this, and that it is valuable effort. And so I just want to close with a thanks and a request. And so really thank you to everyone who believed in us as a new journal. There are a lot of spaces you can share your work, and there are, journals with high impact factors. And so you needed to believe in us and our mission in order to share your work with us. And we have some authors from the first edition who are here. And so my thanks to you for believing in this journal and for the value of open access knowledge and of international sharing and collaboration. Thank you as well to our reviewers. Getting folks to review at any time is an adventure. During some of the highs and lows of COVID has been incredibly challenging. And so thank you to everyone who has stepped up and reviewed one or more articles, because really that, we would be stuck if it wasn't for your time and your efforts. And so that's my thanks to everyone. And lastly, I would just like to say, let's keep going. We have open submissions, so keep sending in your articles to us. Do sign up as a reviewer when you register in the system. We're always looking for more folks to review. And let's keep creating knowledge and sharing knowledge and working together. And let's think of this journal as a real international collaborative opportunity. So this is one webinar where we have a chance to launch the journal, but we look forward to many other knowledge sharing activities in the future that we can do together. So please continue to partner with us. Follow us on social media, submit your articles, review for us. Let's continue to work together and make this an awesome collaboration. So that's all that I wanted to share. I wanted to share my thanks to everyone. Without you, this would not happen. And so now, as I said, we have an opportunity to hear from the authors of the first edition. And thank you all, but one of our authors were able to join us this morning or afternoon or evening, wherever you are in the world. Two of them will be sharing via video, and then the others will be presenting. What we're going to do is we're going to have the authors all present, and then we'll have a time for an open Q&A. So you'll see in the chat there, you can put in your questions. And so we'll go through any of those posted questions. And then if we have additional time beyond the posted questions, we'll open it for more questions and discussion as well. So that's how things are going to run this morning. So we will have 5 presentations, 2 of them via video, and then a time for us to all chat together. So without further ado, I would like to introduce our first speaker for today. Sarah Canham is an associate professor at the University of Utah. She's also the incoming associate director of the International Education Program at Utah. And her community-based research engages with a broad network of providers, clinicians, and persons with lived experience to examine homelessness, service delivery, mental health, and aging. So Sarah, if you want to share your slides and take it away, welcome.
Thank you so much. I'm really excited to be here, even more excited now that I've heard your opening talk, or, just your opening. I mean, I'm really excited about open access journals. When I saw that this journal was launching, as you can see, I was among the first to submit an article. And I'm just really thrilled to be with everyone today. to share the work that my students and I have done. I do want to start by acknowledging that the land where I'm calling from today is the traditional and ancestral homeland of the Ute tribe. So it's the tribes, the Shoshone, the Paiute, the Goshute, and the Ute tribes. And so I want to, in all the work that I do in homelessness and housing security, it's important for me to recognize with respect the people whose lands that I'm fortunate enough to live on, and to be part of. So starting with that, I also want to acknowledge that this is work that I was able to participate in with students Elise Smith and Piper Moore, who were my research assistants in this work. And so we sought to look at what the needs of people experiencing homelessness were and how that compared to some of what we were seeing in the policies in place. So here's the Utah State Capitol. And when we think about policy related to homelessness, we know that it varies across federal, state, and local levels. It influences people's access to health and social services in different ways. I'll use this acronym throughout my brief presentation this morning, people experiencing homelessness. And this acknowledges people who are currently experiencing homelessness, as well as those who have lived or past experiences of homelessness. And so because there's this diversity of community stakeholders, there's also a diversity of ideas about which priorities we should have, what are the health and social services that we should be providing to people, and how do we prioritize those. So even though we know, and I think particularly the folks on this call know this, that there are unique insights that people experiencing homelessness can offer about their own situations, their voices often are excluded from what we see in the research and policy. And so I only moved to Utah in 2019. So when I first got here, I was looking around to see what was going on in the homelessness sector, to think about how the approach to homelessness was, to ending homelessness was being approached. And so I came across the state strategic plan on homelessness. The link is here. This is what the report cover looks like. And I went through the report and I was very surprised to see that the voices of people with lived experience were not included as part of this report. Given the work that I do, it's really important for me to acknowledge, appreciate, and bring light to those voices. So our study, what we did is we sought to identify what were the basic needs and priorities of people who were experiencing homelessness in the Salt Lake County region of Utah. This is just one part of Utah, and to understand how well does this state strategic plan align with the needs of those people who we were fortunate enough to interview. So we talked to 15 people overall, and they were 18 years or older who had any experience of homelessness. So again, some were currently in shelter, some were in emergency sheltered for women fleeing violence, and some were currently unsheltered. We had in-depth interviews right before the onset of COVID here in Utah. And some of the questions we asked people included, what were the services and supports that you feel are most needed? What do you think is most important for people who are affected by homelessness? And what do you think would help lift people out of homelessness? And so it won't be really surprising, and we don't have time this morning to go into depth with each of these categories, but it won't be surprising to anybody here probably that housing and shelter, income and employment, transportation, food, nutrition, mental and physical health services, and then also social supports, whether it's formal social supports or peer networks, and other informal social supports were all highlighted as categories of needs for our participants. And so for each of these categories in our paper, we outline what the needs are as identified by our participants. We talk about the challenges, and we also offer some solutions. Again, this is all narrated by and identified by persons with lived experience. And so I'm just going to give you one example here of how this looks in the manuscript. And so in our category of shelter and housing, our participants talked, as it related to housing, about the lack of knowledge about what housing there is, what are the programs that exist. People were talking about the limited access they had to case management, and particularly housing case management. People have challenges affording application fees, as well as personal histories of domestic violence or incarceration, which then made them ineligible for certain housing programs. And so some of the solutions they offered included increasing access to affordable housing, as well as transitional housing. So for individuals who might need a particularly supported housing location where they can transition from unsheltered street homelessness into some other supported housing location, and really using transitional housing as a place where people can start accessing the services and resources that they need to live independently and self-sufficiently. And then also, what programs could there be to provide rent assistance or rental deposit or utility assistance? And so then people, if we move down to the shelter category there, people were talking about the lack of privacy and the unsafe conditions they felt were present in the shelter system in Salt Lake. That some of the shelter staff display favoritism or lack of empathy. And so I do have a quote for that one here. So this 43-year-old cisgender man says, "It's not cool to say, but we've got to be honest. There's a lot of favoritism in shelters. I've been in the system criminal-wise, treatment-wise for a lot of years, for over 20 years. I'm grateful for where I'm at now, but there's a lot of favoritism. If that could stop, maybe a lot of families would be in better homes." And so another challenge that was talked about in the shelters was that there are very few shelter spaces for families who don't have children. So there's a shelter for families with children. There's a family for only men, for only women. But the shelters where you have a couple who doesn't have children is lacking from the system here in Salt Lake. And so some of the solutions that were identified included having increased security that would help limit any of the violence or theft that occurred in shelters, providing privacy for families and individuals in the shelter settings, and then altering some of the hiring practices or the monitoring and training to the shelter staff that can help promote empathy towards people experiencing homelessness. And so each of the categories I mentioned earlier go essentially in the same system. We talk about challenges and then some solutions. And this is just one example here. And so for us, describing the needs, the challenges, and solutions as identified and narrated by our study participants, we feel it helps offer this critical insight into how homelessness should be approached by policymakers. That the available resources and supports that the policymakers are developing and funding really need to align with the abilities and the realities of people experiencing homelessness. And that without these in-depth discussions with people experiencing homelessness, how do they understand the system? How do they meet their basic needs? There will continue to be these ongoing gaps in service delivery and mismatches in serving this population. So yeah, I encourage you to check out our article. Again, my students, Elise Smith and Piper Moore, were integral to this work, but you can contact myself and I'm happy to chat more about the paper. So I'll stop sharing now. Thank you.
Great, thank you so much, Sarah. Appreciate your article, and I do invite everyone to download it and read that in depth. So that's wonderful. All right, we're going to turn things over to our second author at this time. That's Jill Veenendaal, and she is a PhD candidate in the Health Information Science program, Faculty of Information and Media Studies at Western University, supervised by Dr. Nadine Wathen. Jill's research interests include the role that trauma and violence-informed practices can play in health and social service settings, and her current area of focus is an examination of provincially mandated policies that impact service provision in domestic violence shelters in Ontario, Canada. So, Jill, I will turn it over to you. Thank you for being here.
Good morning. Thank you very much for having me. I'm going to share my screen, and I would just like to say you pronounced my name correctly. Thanks very much. Doesn't happen very often. And I will just, one moment. Sorry, a bit of a delay there. So good morning again. Once again, I would just like to start off by acknowledging that I live on the traditional lands of the Anishinaabe people of Black Skull First Nation, which is part of the Treaty 3 territory in northwestern Ontario here in Canada. So I live in what many would consider to be the far north.
La parte norte, pero sí. Este gusta investigaciones, ha pasado por toda la Providencia.
In southern Ontario, so southwest actually, in London. And I would like to start the presentation by acknowledging that this project that I'm a part of is a community university research partnership. And I'd like to acknowledge the work of the entire research team, including Doctors Eugenia Canis, Marilyn Ford Gilbo, Jen McGregor, Susan Roger, Vicky Smyth, and along with PhD student Caitlin Bird and undergrad student Isabel McLean. And also on behalf of our research team, I'd like to thank our violence against women service partners in the province and the organizations that assisted in the recruitment of staff and women. So I know that was a mouthful, but the point of this work here is that we are collaborating, or have been fortunate enough to collaborate with the community, so that with the hope of connecting our research with practice and ensuring that we have possibility to continue to work together despite the pandemic. So this study explores the use of hotels as temporary housing for women experiencing domestic violence during the pandemic in Ontario. One of the things that the audience should know is that Ontario is Canada's most populous province with 14 million people, which represents about 39% of the population of our country. And domestic violence is an issue across the nation, from the provinces to territories, rural to cities. And essentially, domestic violence shelters present a unique context regardless of where they're located. Even within the congregate living sector, the potential for lethality for women and children from their abusers means that those looking for a place to stay often cannot wait. And as many of you on the call today know, that there is not enough supply for the demand, whether it be domestic violence shelters or homeless shelters in general. So for this study, we used interpretive description and an integrated knowledge mobilization and translation approach. So doing that, we try to maximize the relationship between researchers and those who would go on to use the data in their work. Interpretive description is a qualitative methodology that requires data analysis to go beyond description and emphasize the interpretation and application to create ways of understanding. We used integrated knowledge mobilization and translation approaches for this work because the process of collaboration between researchers and users of knowledge permits access to different professional perspectives, as well as adding organizational and social value. So we had three different groups of respondents. We had women who were staying in shelter and or hotels. We had shelter staff, including frontline workers, outreach workers, managers, and counselors. And then we had 5 focus groups with 24 executive directors of shelters and organizations across the province. from the beginning, we saw
Para empezar, vimos
Entonces,
aquí
pues, desde el
mucha
principio vimos mucha
atención
tensión en todo
a
nuestro
través de
análisis.
este
Todos los
análisis y todos los
participantes
participantes
decían que tenían
experimentaron
alguna clase de
algún tipo de
reflexión, que se sentían
reflexión,
conflictados
sentirse
sobre los
que
hoteles.
aquí estos
Teniendo un
hoteles
lugar donde
es un lugar para
es un lugar donde dormir.
to recover and reset after leaving a violent relationship. So there are benefits and drawbacks from everyone's perspective. What we saw, we put these sort of in order of significance. We saw this notion of autonomy and independence versus accessing support. During the COVID-19 protocols here in London, in Ontario, there were extreme lockdown situations, and shelters were only able to support women if each person had their own bedroom and their own bathroom. So shared rooms and shared bathrooms meant that some shelters experienced a reduction of up to 75% in capacity. So hotels were used in many cases as a backup, so that when women
un respaldo, y entonces cuando las mujeres vienen, entonces necesitan otro lugar a donde ir. Desde esta perspectiva, esta era la única opción, pero también cuando tenemos esta significativa preocupación, entonces esto puede ser adecuado o inadecuado. Aun cuando esto representa un desafío para ambos, para mujeres y para lo que son el personal, y que tenemos esta solución que puede ser inadecuada muchas veces. Entonces, basado en algunos de los hallazgos que hemos encontrado, en donde realizamos aquí hoteles para lo que son algunas preocupaciones de seguridad, no saber quién viene, quién está aquí en el hotel. Entonces esto podemos darle a otras personas. Tenemos, por ejemplo, mujeres que están aquí hablando de ver a otros hombres en el hotel y que también pueden ser violentos, que también puede haber abuso. Y ese puede ser una situación incómoda también. Entonces, eso también significa que
a single room makes it very difficult to manage your day when you've got young children, well, any children. And during the lockdown, when school was all online and preschool was closed, we had some respondents that were in hotel rooms with 3 young kids under the age of 5 in one room. So that made lunch, nap time, trying to talk to their counselor on the phone and not waking up their children made life very difficult for women. We also saw that in order to decide who goes into hotel and who goes into the shelter, staff needed to triage clients, and they felt very uncomfortable with this idea. And the other side of that coin, when not only staff were uncomfortable, but there was this risk of women who had made the effort to leave and get help, and then to be told that they weren't quite fitting the criteria for shelter, so they were put in a hotel without lack of supports. And there were worries around what that would do for the self-esteem of women who were trying to leave abusive situation. So this is really an untenable situation for staff, particularly as some felt that even though there were policies in place or trying to support where people went, there was often some subjective work that went into that process, making it uncomfortable. We do know that using hotels for temporary housing does support autonomy and independence. So one of the most significant benefits during this time was that women were in quarantine and shelter for 14 days, often in their own rooms for that time, and not able to come out and having meals delivered to their room and whatnot. And that wasn't the case for women in hotels. They were able to come and go and at least get outside and get some fresh air if they wanted to. This really supported those who were trying to maintain a sense of normalcy in their lives, especially for women who had supervised visitation with their children. If they stayed in hotels, they could maintain those relationships. If they were in the shelter, they often had to quarantine every time they came back from a visit. We know that using hotels as temporary shelter also requires a lot of relationship building and communication between hotel owners, managers, staff, and shelter staff and executive directors. Ongoing effort is required. It's not as simple as setting up the space. There needs to be open communication about challenges and potential issues. And when something does happen, people need to work collaboratively to address concerns. So this was an added step and more work for both staff and managers, both at the hotel and shelters. And it's also harder to meet the tangible needs of women living in hotels or staying in hotels for extended periods of time. The things that we don't think about that would be available, like snacks or body wash, shampoo, all of those sorts of things that might have been available at the shelter were not necessarily available to women in hotels. Less choice for food delivery, and some shelters gave women gift cards so they could leave and go shop on their own. But at the end of the day, the equity was just not there. And we saw that women in shelter had access to much more in terms of stuff for their children, things that they could use to start their job searches, materials and whatnot. So there was definitely something to be considered from that perspective. But we do know that hotels played a critical role during the pandemic for providing space for women and their children who otherwise would have been turned away from shelter. And we did hear women say, I might have gone somewhere else, but I didn't want to impose on my grandmother because she's elderly and the risks were higher. And participants reported benefits and drawbacks to every single potential place for temporary housing. So it was quite difficult to make the decision. So while all sectors were doing their best, or that's what we like to think, during the pandemic, the initial days, things were uncertain and policies were rapidly changing. These were rapid and inflexible responses in many cases. And when governments applied those rules, or public health departments applied those rules to fit across all sectors, you know, supposedly to protect people's lives, it also put others at increased risk, especially those who are trying to manage addictions, trying to stay safe. Very difficult, because we know it's not a one-size-fits-all situation. So moving forward, hotel use during any kind of pandemic should be considered carefully in the context of women's needs, as well as the fundamental intent of shelter services. So domestic violence shelters are a place where you can go and move forward through the shelter system to get out and into permanent housing. They are not a place to just lay your head like a hotel would be. So our aim with this study is not to assign blame, but to provide insights for future responses that can account for different realities faced by the groups and people who serve them. So the limitations of the study, I think it's important to acknowledge this, that it was really hard to recruit women to speak to us during the study. Many women were in their rooms and wouldn't have seen posters put up, didn't have access to regular contact with counselors because they were busy trying to sanitize areas of the shelter and deliver meals. The women who participated were not representative of the diverse community of women that access domestic violence shelters. We had an entirely Caucasian response or set of respondents. And that is not reflective of what we see in shelter. And all of the participants were citizens. Only one was an immigrant to Canada. And we know that the accounts of these cohorts changed over the course of the study, because this was carried out in 2020 prior to vaccines being available. And at least in Ontario, we had phases of the responses to the pandemic. So those who were in shelter when things were particularly tight in terms of rules may have responded differently than those who came in a little bit later and perhaps had more access to things like TVs in their rooms and more opportunities for their kids to go outside and play on the playground. So we know that that is not a consistent reflection. That said, we would have liked to follow women through to see where this was heading and what, you know, from a longitudinal perspective, what these outcomes are. So that's certainly something that we're looking forward to following up in the future. And that's it for me. I'm sure I went over time. Thank you very much. And I will turn it back to Abe.
Thank you, Jill, very much for sharing. And I must say, your paper did, open my eyes on some stuff. We were, so desperate at the outset of just having the hotels as an option. And what you shared in your article and plus what we've heard around our own community has really helped me understand, it's also about the how, right? And the, the policies and the services that are attached, so that it's not just a space for people to land, but does it actually support people? Does it make them more or less safe? So yeah, really helpful.
I do apologize for missing the recommendations slide. I stopped there, so I'll put that in the chat for folks. But thank you for the space and the time to present.
Thank you. So I'd just like to remind people, as has been done in the chat, that there's space for Q&A, and so do post your questions as we go along, and then at the end of the speakers, we'll have a chance to address those questions. And also a reminder that at the bottom of your screen, you'll see a translation button that you can choose English or Spanish translation for any of the speakers. And so that brings me to our next speaker, who will actually be sharing via video. This is Thomas Evans, a sociologist at the University of the Republic in Uruguay. His master's thesis analyzed factors and exit processes from homelessness. He works as a technician in the Evaluation and Monitoring Division of the National Directorate of Transfers and Data Analysis of the Ministry of Social Development of Uruguay, where he's worked on various studies on homelessness in Uruguay. So Julia, if you want to go ahead and cue up that video for us.
Are you able to see the video now?
Yeah.
Okay, perfect. And then this video is going to be in Spanish, so just make sure to turn your interpretation to English if that's your preferred language. So I'm going to hit start.
Hola, buenas tardes. Mi nombre es Thomas Evans.
Hello, good afternoon. My name is Thomas Johnson
Bueno,
from
les
Uruguay.
agradezco mucho por
Well,
darme la oportunidad de
thank you for giving me
participar
the
en este evento, de
opportunity
ser
to
parte de la revista. Para mí,
participate
la verdad que
and to be part
es
of the journal.
un honor poder ser parte de esto, así
To
que
me, it's an honor to
muy
be part
agradecido
of
por eso.
this. I am very
También por,
grateful for
bueno,
that.
traducir
And then
esta
also for
presentación. Pido
translating this
disculpas por no poder hacerla
presentation. And
directamente
I apologize for not being able
yo,
to do
pero
it
bueno, creo que lo mejor
directly
es que lo pueda traducir
myself,
alguien y que todos
but I
puedan
think the
entender de la
best is
mejor
someone
manera
to translate it and
lo
maybe
que
you
quiero
can
transmitir.
understand in a better way
Les voy a compartir
what
pantalla
I'm trying to
con
say.
la presentación que armé,
I'm gonna
bueno,
share my screen with my
por lo menos
presentation.
traté de traducir el
I will at least try.
texto. Si hay errores ortográficos
The
también,
text.
desde ya les pido
I
comprensión.
apologize. I hope that you guys can
Bueno, el
understand
trabajo que
it.
les voy a presentar
The work that I'm
se centra en
gonna
el
show to
análisis
you
del proceso de salida
is
de
the
personas que fueron usuarias del
analysis,
sistema de refugios en
and
Montevideo.
so the people that use a
El
shelter
contenido de
in
la
Uruguay, in
presentación,
Montevideo.
que la idea es que
And
sea
the
bien
content of
breve, es
this,
presentarles algunos datos del
I hope
contexto
it's very
uruguayo
brief,
sobre este
is to
tema,
present you the context
algunas
in
referencias
Uruguayan
conceptuales sobre las cuales
context,
se basa este
background
estudio,
and exit for
los
homeless,
objetivos y la
objects
estrategia
and
metodológica en la cual
methodological
se basa, sus
strategy,
resultados y las
in which is
conclusiones.
based, and the results and the conclusion.
Bien, el tema de
The
acá se le
theme,
llama situación de
theme,
calle,
we call
que
it
quizás
street
bueno, es el término que se
situation.
utiliza aquí en Uruguay y también en
That's the
otros
term
países
that we
de
use here in
América
Uruguay and
Latina.
other
Sé que en España se
places
habla más
in
del
Latin
sinhogarismo,
America.
bueno, esto es una discusión que no voy a entrar ahora, pero
This is a
bueno,
discussion
voy a
that
hacer
we're not
referencia
going
a
to
la
have
situación de
right
calle
now, but I will
sinhogarismo
make
como sinónimo
reference
de las
to
situaciones en las cuales
the street situations and the situations
hay
in
personas que
which
están sin techo, es decir, en
there's
intemperie,
people
o
that are without a
en
shelter
refugios, ¿no? Sabiendo que hay otras
or
definiciones
that
que
are
no hay una
in
definición consensuada.
shelters.
Bueno, para cuando hable de situación de calle en este trabajo en particular,
So
voy a
when I
estar haciendo
talk
referencia
about the
a
situation
esas dos
of
situaciones.
the situation of the street, those
Bueno,
are the
este tema de la situación
situations.
de calle es un tema que
This
en los últimos,
this is
yo diría en las
about,
últimas 2 décadas tiene un peso cada vez
I
más
would say
grande,
in the
tanto en las
last 2
agendas
decades
políticas
started
como
getting
académicas,
bigger
sociales y de los
based
medios
on
de
both in the
comunicación. Es un
agendas
tema que no pasa
political agenda
desapercibido,
academic.
que tiene
It doesn't go under the
implicancias
radar.
de distinto tipo.
It has
Bien, este
different
incremento
types.
que les mencionaba en la agenda pública
And
también está
then
relacionado,
there's
que
an increase.
es un problema que crece a lo largo del tiempo.
It is a problem
En
that
el
is
año
growing at the
2021
same
tenemos un
time.
total
And
en
in the
Montevideo
year
3.907
2021,
personas en situación de
we
calle, de
have
las cuales
3,000 and
2.987
situations out of the
estaban dentro de
street,
los refugios
in
y
which
920
over
al
a dozen
intemperie.
were in refugees in the
Esto, como
shelters.
saben, es la foto de un momento.
This, as you
Los
know,
conteos
is this
son,
a picture of the
se hacen
moment,
en
the
una jornada
counting
y se contabiliza lo que se encuentra en esa
are
noche. Cuando
done
uno
in a
empieza a sacar
time,
una
and then
foto,
they
intenta más
update it.
bien ver una película de un periodo más amplio. Lo que se ve, por
It's
ejemplo, es
like
que
watching a
en el
movie
caso del
in
sistema
a
de
longer
refugios, en los
term.
últimos 15 años,
In the
25.000
case
personas han
of the
pasado por ese
refugee
sistema.
system,
Y
in over
también se
15
sabe, en
years,
base
over
a esos registros
25,000 people have
administrativos,
passed through that
que 2 de
shelter
cada 3
system.
de esas personas han salido del CISON.
Every 3 of those people have
Algunas
gone out of the
referencias
system.
conceptuales utilizadas en
Here's
este
another
trabajo. Lo primero es
reference.
que
The
específicamente
first
sobre el tema de
is
las salidas y situación de calle,
specifically over
no
that
encontramos
about the access of the
mucho antecedente ni aquí
homelessness.
en Uruguay ni en
We
América
don't
Latina.
find any background
Sí,
in
en otros-
Uruguay or in
en
Latin
otros lugares del mundo.
America,
Y lo que consiguen estos
but
trabajos
in
es,
other places of the
bueno,
world.
promover
And the
estudios
studies
que sean de
are
tipo longitudinal
to
y
promote the
retrospectivo
studies
que
are
den
to have
lugar
an
al análisis
objective
de
to give an analysis,
la dinámica de los procesos, que como se sabe, no se
the
trata de
analysis and the
procesos
process.
estancos en el
Like as you know,
tiempo,
it's not about the
o
process,
particularmente en
it's
la
about
trayectoria
the
de las
time.
personas,
It's about the
procesos que
people,
se perpetúan a lo
the
largo de la vida
process
de las personas, sino que van
that you can
variando.
see in long life
En lo que
term.
coinciden varios estudios y que también coinciden
What we
estudio
the
analicé también en el marco de la
studies
tesis
agree is that
de maestría, particularmente estudios de tipo cuantitativo, es que las trayectorias en situación de calle son
the
heterogéneas,
trajectories
permanencia en la situación de calle, pero que
is
prevalecen
the
las situaciones
permanency
de
of the
intermitencia, es decir,
people,
entrada y
the
salida,
homelessness
y de
that come in and
periodos
out,
cortos de
and
permanencia
the short
en la
periods
situación de calle,
of
es decir, como procesos
how
puntuales
long
en la
they
trayectoria
stay out in the streets,
de una persona.
and the trajectory of a
Otra de
person.
las
Another
líneas conceptuales que retomo en este
one of
trabajo
the
son
other principal
la
lines
tipología
that of
de
my job
salidas, que algunos autores hablan de salidas independientes y
is
de
how
salidas
they
dependientes. Esto
exit.
lo voy a retomar
Some people
más
come and
adelante.
leave independently or
Entonces, el objetivo del
codependently.
trabajo fue analizar el
The
proceso de salida
objective of
de
of
situación de
this
calle
work is
de
the
ex
exit
usuarios del
and the
sistema de refugios
situation or how of their
del
the
MIDES, que
situation
fueron
of them
usuarios durante el
exiting.
periodo 2014-2017, en algún momento de ese periodo,
The
y que
people that
tienen una
were
salida
from
de
in a
menos 6
period
meses.
between 2014
No tenían
2017
tiempo.
and they leave, they didn't have the
Entonces,
time.
bueno, ahí también un objetivo más específico fue considerar la
And then there's
tipología de
another
las
object there
salidas dependientes e
is
independientes y
to
ver
think about the
si son
methodological
pertinentes para
strategy
el análisis de los tipos de trayectorias que se
to
dan en Uruguay.
see
Y,
if they fit
y
into
bueno,
the
acá lo que se
Uruguay
propuso fue hacer un
status.
análisis retrospectivo y biográfico
And what they say what it was
de
proposed to the
las
an
entrevistas
analysis
que se
about the
basaron en
interviews
30
that were
entrevistas que fueron
based,
a personas que seleccionadas
and the interviews
aleatoriamente,
were for people that were
con algunos
leaving
estratos específicos
that
porque
were
se buscó
exiting
que no hubiera
with
una
some
sobrerepresentación
points
por edad
to represent
o por tiempo de permanencia en el sistema. Se buscó que haya la mayor
based on
heterogeneidad posible.
how permanent they were there.
Entonces, bueno, yendo directamente a los resultados, lo que
And so then
se
here
ve
the
que los procesos
results.
de
So the
salida
based on
son
the
heterogéneos, es
process
decir, no es que haya
of exit is in the street
un único tipo
situation.
de mecanismo de proceso de salida,
It's the mechanism of
entran en
of
juego
the way
distintos
they
factores,
exit.
tanto estructurales
There's
como
different
institucionales,
factors,
relacionales
structural and
individuales.
institutional,
Entro más en detalle cuando describa
and then I can go more in
a los
detail
tipos de salida.
in the type
Y lo que sí
of
se da
the
más,
type of exits.
como, creo, más
What do you
común
do
en
talk?
estas
And the
en estos
most
30
common
relatos es que las
topic
salidas se dan como una
in the data is that
búsqueda de las
exit
personas
is like a
como
finding of a
estrategias
person,
de
like
supervivencia,
strategies
más que de
of
un
surviving
proceso buscado
strategies,
con un apoyo institucional
finding the process
con un apoyo material para que se
to
dé esa
find
salida.
to support them,
En
to
algunos
help
casos lo que
them,
se da
to
es,
like give
yo le llamo una salida
them a materialistic
azarosa,
support to
que se
help them
cataliza por la
exit.
construcción de distintas situaciones que se le dan a la persona y que logran que se
And
vaya
then
del
based on
sistema.
every
En otros
person's
casos sí hay un plan
situation, and
más
then in the system, and then there's a
planificado
plan more
de la
modified
salida.
about how to exit.
Pero también un tema
But also
común
there's
acá lo que
the
se ve es que
topic,
tenemos
common
una única
topic
agencia pública,
is
en este
that we
caso
only
el
have
Ministerio
one
de Desarrollo
agency
Social, a cargo de atender
for
problemas
social
que exceden a sus
services.
competencias. Es decir, acá
There's
hay
problems
temas de
of
vivienda, temas de empleo,
competition, and then there's
temas de
themes
salud,
about
entre
housing.
otros,
There's topics about housing,
bueno, que son
about
atendidos sin
health,
las herramientas que debería contar,
and then the tools to
que se
be
debería contar
helped,
para
to
dar
be
una respuesta
assisted,
adecuada a esa
and to make
a
sure
las
that we
situaciones,
have a
más
right
pensando que
response for them.
son vulneración de derechos, ¿no? que deberían ser,
And then it's their right, it's their rightful,
debería
and
hacerse
then it's their
cargo
right.
el Estado todo y no solamente un único organismo.
And then not only the state
Bien.
should take care of it,
Las
besides
tres
not only the community but the
tipologías a las
whole
que
state.
se llegó con el análisis de estas
Typologies
entrevistas
that
son
we talked
salidas
about
independientes,
these
salidas con
interviews.
apoyo de redes primarias y
Either you
salidas con
exit
apoyo
independently or you exited with
con
support,
apoyos institucionales. Como ven,
or you
no
exited
utilizo aquí la
with
palabra dependiente porque
institutional
en el caso del
support.
idioma español
And I don't use the
una
word
connotación
independently
algo
because
negativa,
it's
entonces
a
hablo más del
connotation.
apoyo que
It's
puedan recibir
something negative.
más que
It's
de la
more
dependencia
the
de.
support that they can receive, and not so
Entonces
much on the
las salidas independientes se
independent.
centran
So
principalmente
independently
en procesos
mainly
autónomos donde se relacionan al acceso a empleo, a la mejora de los ingresos,
it's
a la
by
mejora de un problema de
themselves.
salud, o el acceso a
Maybe
la
there's a
vivienda.
problem with their
Siempre
health,
por cuenta propia de la persona y no por un apoyo
so that
externo.
means they're going on their own and
Las
without a
salidas con
support.
apoyo a redes primarias, acá lo que se
Exits
hace
was
el apoyo
supported by primary network. The
de familiares,
process
de parejas, de
is of the
de
is the
amigos o de
support of
compañeros que lo
family
que hacen es
members,
ofrecer un lugar en el cual
partners,
irse a
friends,
vivir,
that which they
aunque
provide
sea
a place
permanente
to
o aunque sea
live,
provisorio, a
even
la
if it's
persona
permanent or
que está
temporary.
en el refugio. Esto es la connotación
And
que tiene
if
es
and
que
then
la calidad de la
if
salida
they're not,
queda
as
muy
long as they're
atada
not in a shelter, and
a
then
las condiciones en las cuales viven sus redes primarias, que suelen ser en general, no
and then
siempre,
it
pero
also
la
depends
mayoría,
on how their family lives,
en
how their
condiciones o de
primary
hacinamiento o de
acquaintances
vivienda
live.
inadecuada o vivienda
Other
insegura.
they live, how's their housing? Is it a
Y
safe
esta
place?
es,
Is
si
it
bien acá no
a
se busca una
place for sure?
representatividad necesariamente estadística, es la trayectoria que tiene
And
mayor
then,
cantidad de casos.
and statistically is,
Por
you know,
último,
the
la trayectoria
trajectory
con
where
menos
they
cantidad de
go.
casos es la de los apoyos institucionales,
And then
que
the one that
en
has less
4
cases is
casos,
actually with institutional
que
support.
fueron los que
There's
están
like a
dentro de esta
fewer
tipología,
cases. What you're
coinciden en que
seeing
acceder a una
this
transferencia monetaria
is
que les
it
corresponde acceder por un
coincides
tema de
when
derechos,
we
en
talk about the
algunos casos por
topic about
discapacidad
the
y en otros casos
rights,
por vejez. También hay
and
que ver
then
que en este
it
caso no
has
es
to
que
do because of
el
the house
acceso
and because of aging.
a la transferencia de por sí mismo generó la salida del
And then also,
sistema,
you know, how it
porque se
generates the
trata de
exit, the
ingresos que son,
system.
para que tengan una
It
idea,
depends on the
$250, con
income.
eso aquí no se puede pagar un
It's
alquiler,
$50 because they give them
sino que
$50,
bueno,
which
damos una
here is not
base
enough.
sobre la cual poder
And that's
proyectarse
is
y en base a
they
algún
need
otro
them
tipo de
as a
sustento o algún
base
otro tipo de apoyo
where they can
complementar
give them another kind of
y, bueno,
support
y catalizar el proceso de la
and
salida.
catalyze the system of the
Así que algunas
exit.
conclusiones es, bueno,
And here are some
hay
conclusions.
escasas o pocas políticas
There's very
institucionales
little
que trabajen
or very
en la
little
prevención y en
institutions
la salida
that work in the
de la situación de
transition and
calle.
the
Entonces ahí hay
exit.
como una oportunidad importante de desarrollar
And there's a
estrategias
need and
de apoyo
opportunity
para las salidas en situación de calle,
and support
fundamentalmente a
to
través
leave
de la
to
de la
leave
vivienda, pero
the
también a través de
street
otro tipo de apoyo, como
situation.
puede ser el
And
empleo,
there's other type,
el acceso a
the
atención a algunos problemas
access
de salud,
of
tanto de adicciones
attention
como
to the
de salud
health and
mental
to
u
the
otro tipo,
addiction
y
and other
también
types, and also
bueno, y otro tipo de dimensiones que también requieren
and
atención.
another
Y
things that
también
also
hay una
require
oportunidad
the
del avance en las
attention.
políticas de
And they have also
detección,
a policy
que
for
aquí el
prevention
trabajo interinstitucional
and
sería
the work they
bastante
make
importante
institutionally.
porque acá hay que
It is
articular
very
distintas
important
respuestas
because here you
sobre
hear
distintos
different
temas,
answers
como les decía, el trabajo, la
about different
vivienda,
topics,
etcétera, y en particular
about housing, about
el-
work.
acá tenemos un tema con las instituciones
We
totales,
have
por
a
ejemplo, en el caso de las
we
cárceles
have a
hay un alto
topic
nivel de
about, like for example,
personas privadas de libertad
jails.
y sabemos que hay un vínculo bastante
We know
estrecho
there's a
entre la
liberty,
situación
these
de
people
calle y
are
la
going to
salida
liberty.
de la cárcel y viceversa.
We know people are going to get
Y también
out of the
instituciones de
jail.
internaciones por problemas de
There's
salud mental y
institutions
de institutos que atienden a menores de edad que no tienen, que están
that help the
que son
people of
huérfanos y
age
que bueno, una vez que tienen la mayoría de edad salen de
that don't
esas
have
instituciones, pero
parents.
no tienen a dónde
And then they
a dónde ir.
talk
Entonces
about
también
those
ahí hay una
institutions.
parte sobre la cual hay un margen de acción bastante grande.
There's
sobre el cual poder
it's a big
actuar.
margin.
Bueno, muchas gracias
Thank you
por el
very
tiempo y
much
bueno, quedo a disposición
for
para
the
seguir
time.
intercambiando
And
por correo electrónico
I'm happy
o
to
por otro
exchange
mail. Muchas gracias.
emails and to get to know me. Thank you.
All right. Well, thank you, Thomas, for sharing your video. And I do invite you as well. We have both a Spanish language and an English language version of his paper. And you're welcome to give that a read for more detail than he was able to share in a short video. All right, that brings me to our second last speaker, and that's Peter Mackie, who is a reader at Cardiff University in the School of Geography and Planning, where his work's on the development of homelessness policy and law through research and advisory work, particularly in relation to homelessness prevention. And he has served as an advisor to many organizations, including national government in the UK, FIANSA, and the Center for Homelessness Impact. So without further ado, Peter, I will turn it over to you.
Thanks, Abe. Right, let's see if we can get this sharing. Good. Can you see that okay? Oh, here we go. Let's make this a bit clearer. Can you see that okay?
Yes, we can.
Yeah, that's perfect.
Super duper. Right, here we go. Pronouns are good afternoon and buenas tardes. Thanks for the opportunity to present today. My apologies to our translator if I speak a little bit fast. I get excited.
Si hablo rápido porque me alegro, porque me emociono. Y alguien dígame si estoy yendo muy rápido. Mi presentación de hoy
Mi presentación el día de hoy, en donde tenemos aquí esta perspectiva para la prevención de las personas en situaciones de calle. Mucho de nuestro enfoque cae en este punto de la crisis para poder es que estos contextos, estos problemas, las implicaciones. Tenemos esta participación para poder categorizar y esta...
Essential tools, especially if at international level, as the journal's trying to promote, we're looking to compare and understand and share lessons. They're essential. But in this work, we basically take as our starting point that there is no typology that we think is currently sufficient to enable the sorts of comparison and stock taking that we'd like to see. And that's basically because we either have very, very basic typologies, the primary, secondary, tertiary prevention typology in public health, to what we describe as the bewilderingly complex. And often the tension is about, do we focus on population-based interventions, or are they temporally driven typologies? And we're advancing and advocating for a much better temporally driven typology. And I have to say the starting point for this, and why we say advancing, not creating, is that this comes from a third sector organisation, an NGO in the UK called St Basil's. They started the thinking around this typology. We're just advancing it. And we're going to use this, or in the paper we use that to basically examine and assess UK policy in relation to this typology. And I'm going to do my best in 9 more minutes to run through our findings. I won't spend any time on the methodology. So this is the typology we're advancing. We go from universal prevention, and that's where we're aiming to prevent or minimise homelessness across the population at large. That's things like welfare benefits, provision of sufficient affordable homes. We then look at upstream prevention, which is early stage prevention focused on high risk groups such as vulnerable young people or people facing risky transitions from institutions. We then come down the temporal typology to what we call crisis prevention, and that's where homelessness, we're preventing homelessness where it's likely to occur within a foreseeable time period. And in the UK, a foreseeable time period is often quite predictable. So we have an eviction notice, and at the moment that's 2 months. Homelessness is predictable. And then emergency prevention is support for those at immediate risk of homelessness, i.e. that day, today or tomorrow, somebody is going to end up homeless. And then last of all, within this typology, we include repeat prevention, which is essentially, as it says on the tin, preventing the recurrence of homelessness. So that's our typology that we're advancing and advocating for. And I'm just going to run through essentially our scorecard for the UK nations. So UK universal prevention, at the heart, statistical modelling has told us in the UK, and also the literature internationally tells us that the most important driver of homelessness in all its forms is poverty, and other key structural drivers include availability and affordability of housing. And the lesson is, particularly in London, UK, and London, England, and the south of the country, we're doing really badly around universal prevention. And that reflects government policy, where we've seen a decimation of the welfare state and welfare policy to support the general population and those on lowest incomes. We also have some areas where there are very acute housing pressures. The story's a bit more mixed across the devolved nations of the UK, and that's generally as a result of areas with lower housing pressure, or because we've got devolution, there have been mitigation measures. So in Scotland, for instance, a much higher investment in social housing. Upstream prevention. This is the bit where I want to see us doing the vast majority of our work, and we're not there yet. The verdict, despite really good evidence by a lot of wonderful people, including folk that have signed in to this talk, is that we know a lot about those who are at greatest risk. And there's all this policy interest and skill sets in predictive analytics, but we're not doing very well to identify and intervene with those we know who are at highest risk. And our research lays that bare. Pretty much everyone we spoke to said that. And part of it is because we stay entrenched in the housing world in the UK, and we see homelessness as a purely housing problem. But actually, responsibility for ending homelessness is everyone's business. And it's in health, it's in education, it's in the criminal justice system where actions need to be taken. There are some exceptions. We're currently piloting Upstream, which is a school-based intervention, which I can talk about more if we have time. Crisis prevention. So this is the foreseeable homelessness. This is where the UK and particularly Wales and now England is probably world leading. We can actually say well done. In 2015 and 2018, respectively, in Wales and England, we introduced legislation that places a duty on local authorities, municipal authorities, to take reasonable steps to prevent homelessness with anybody who is identified at risk. So if they've been issued an eviction notice. Sometimes by my awesome Canadian colleagues, this is called duty to assist. And you can see the quote there that gives the sort of reaction to the effectiveness of that legislation. At emergency prevention, so this is homelessness is going to happen today or tomorrow. The verdict is pretty mixed, but mainly poor. There is no obligation, despite these progressive crisis prevention duties. There's no obligation in England, Wales, or Northern Ireland to provide emergency accommodation. That puts us in a weaker position relative to a lot of European countries, relative to New York City, etc., where such duties exist. In Scotland, there is a duty, and we saw its effectiveness. When COVID hit in England and Wales, we scrabbled to find hotels and B&Bs exactly as was described to us in our previous talk. In Scotland, that wasn't necessary because the duty already existed. And also some of the similar stories we've heard around inappropriate emergency provision that also persists in the UK context. On to our last one, on to repeat prevention, and I'm nearly there and I think I'm on time. Repeat prevention, again, there's a very varied story, but things are improving. In Scotland, essentially, if you become homeless, there is a duty on local authorities to provide you settled accommodation. That normally takes the form of social housing, irrespective of whether you're a single person household, a family. And we've seen the effects of that in minimising repeat homelessness. In Wales and to a lesser extent Northern Ireland, we have a supporting people programme. This is money invested in folk that provide the supports once somebody has been accommodated to prevent recurrence. That support used to exist in England, but again has been decimated. And of course, I saw Sam is on the call, Sam Semberes. We have Housing First. Finally, how many decades after you told us to start doing it? 2 decades after, we're finally investing in Housing First and more housing-led responses, which are reducing repeat homelessness. So what the paper does, and I won't have done justice to it today, is we make the case for this 5-stage typology that gives primacy to the timing of interventions. And we argue that this has international relevance. And what in our application to the UK case, which we give in more detail in the paper, it tells us, look, there's been a shift in thinking, in policy and in practice, away from the emergency response to kind of crisis prevention. But there's a huge way to go and an urgent need to move further upstream with our efforts. And you can imagine using this typology to draw comparisons internationally or within local authorities or within states or provinces could be a really useful tool to help guide us in our efforts to move further upstream and really reduce and minimise the harms of homelessness. So cannot wait to take questions and talk about it, but equally happy to take questions offline. Thanks very much, Abe. Diolch yn fawr.
Great, thank you. Really appreciate that. And I agree. I think it's a very helpful typology for policy analysis and both locally and internationally. So look forward to hopefully lots of folks taking that up and taking up the challenge to analyze their own area. All right, and this brings us to our last presentation. This will be another video presentation. This is from Nick Kerman, who's a Canadian Institutes of Health Research funded postdoctoral fellow at the Centre for Addiction and Mental Health in Toronto. He's a mixed methods researcher of homelessness and housing interventions, the social determinants of health, community mental health services, community-based service, safety and risk management, and healthcare experiences of marginalized and underserved groups. So Julia, if you want to cue up Nick's video for us.
Hey everyone, unfortunately I was unable to attend the webinar here today, but I'm delighted to be able to pre-record this to provide a brief overview on my paper in the first edition of the International Journal on Homelessness, which focuses on universal basic income and homelessness. UBI often pops up in the media in opinion pieces like these, and it's often billed as, you know, one of two extremes. It's either a solution or it's a potential disaster with regards to, you know, poverty reduction and related economic and inequality problems. And when it comes to homelessness, there's really not much discussion of what a universal basic income could do. And so that's where my paper comes in to talk about potential benefits and risks, and just look at what is the existing evidence that we have, which might signify potential problems, as well as how this could be beneficial. For the paper, I defined universal basic income as any intervention that involves a cash payment that is provided to all or most adult citizens. This is commonly the defined population for UBI, and that it is a livable amount, and we'll come back to that when we talk about benefits and risks, and it doesn't phase out, or it does so at a income level that is very high and really would not be relevant to a population of people currently experiencing homelessness or formerly homeless. When it comes to existing evidence, there really isn't a lot with regards to housing and homelessness outcomes. Ontario had a negative income tax pilot, which is a variant of UBI, that had over 400 enrollees, and asked about perceived impacts of being a part of this program. And you can see there that the majority reported improvements in their housing situations. But beyond that, there's not much else. Now, other types of cash transfers have been tested with people experiencing homelessness with positive effects. A recent example being the New Leaf project in Vancouver, which provided a lump sum payment that was much higher than income support plan program payments. And that was preliminary evidence showed that it was helpful in helping people to exit homelessness. So there is promise there. And from that, I identified a number of potential benefits and some risks that need to be considered. These are by no means exhaustive of the benefits and risks related to a transformative social policy like UBI. But there's some ones to really get the conversation started. In terms of benefits, UBI would really do away with values-based exclusion in the provision of income support. So people are no longer required to meet an eligibility criterion around a disability or an income level or a work history. And so people cannot be excluded because they're not disabled enough, they're not poor enough, or they haven't worked enough. it is universal in who is receiving this. It has the potential to promote choice in housing. If UBI is indeed livable, that income level could enable people exiting homelessness more choice and control in rental housing options, so that it's not just a roof over one's head, and instead it's something that is perceived to be good quality, it's safe, it's in a community that people want to live in, and really it's somewhere that they could potentially call a home. UBI, in terms of prevention, one of the things that it could be very effective in is facilitating workforce returns. And so really where this comes from is recognizing that current income support programs disincentivize returning to work through clawbacks to income and those sorts of things. And so UBI doesn't have that disincentive, which allows people to not just have their livable UBI income, but also then make strides towards getting a part-time job if that's something that they want to do, or pursuing education for a potential career that they're interested in. And then, of course, UBI has often talked about in the context of automation job losses. And there is some evidence that certain groups that are at risk of homelessness are also at increased risk of automation job losses. And then there's the potential that the increased income from UBI could improve mental health and well-being. And there's some existing research that demonstrates that with other populations. There are also a number of risks that need to be considered, principally around what will happen to existing best practices and other services if UBI is funded, recognizing that there are really important complementary services out there that would need to continue to be funded and be essential for those that are exiting homelessness or experiencing it. And we have best practices around ending homelessness, such as permanent supportive housing and housing first. UBI cannot replace these existing best practices, but rather can add to their effectiveness and their utility. And then last but not least, what are the groups that could potentially be excluded here? Youth, for example, that wouldn't be adult citizens, newcomers, again, if you're not a citizen of a country, would you be eligible for UBI? And so these are key things that would need to be considered and advocated for. Really, at this point, it's too early to say that UBI will be effective in preventing and ending homelessness. There is some evidence and it is promising, and really we're overdue to test it. What we know is that what we're currently doing, the income support programs that we currently have, are not working in preventing and ending homelessness. And so while UBI will not be a poverty reduction panacea, it has the potential to augment existing interventions like permanent supportive housing in the prevention of homelessness and interventions to end it. I'd just like to thank the International Journal on Homelessness for publishing my discussion article and congratulate them on a successful launch. And thank you to the Ruff Institute of Global Homelessness for having me here today. If you have any questions about the paper, please feel free to reach out. My contact information is there, and it's open access. So please check it out. Thanks very much.
All right. Wonderful of Nick to be able to share that with us. And I couldn't help but make a connection, between Pete's typology, and this was accidental. We didn't line up the presentations in this order on purpose, but Nick's conversation as part of thinking about what are those level one potentials, right, in terms of thinking about better models of income supports. So please do add any questions to the Q&A or to the chat, and we'll keep an eye out for those. In the meantime, I will take the moderator's privilege and ask a couple of questions myself. And so my first question is to you, Sarah. And I was really interested in your conclusion around, in your paper, you talk about this value of informal support. And actually that links kind of to Thomas' presentation as well, where he talked about that primary network as being, you know, a big support for lots of folks exiting. So I always wonder about informal support because, you know, in the very definition of informal, you know, is that it lives outside the system. But is there a role within the system? So, you know, you put forward the argument about having people with lived experience, you know, speaking to policy. Do you see opportunities, or do you hear from folks about ways that the system could help, you know, build up that informal support?
I'm going to attempt a response at what I think you're asking, but I might be off. So I think there have been really interesting movements in the healthcare fields towards like patient-centered research outcome initiatives like the PCORI movement, and really valuing and prioritizing the voices of patients within research, which then leads hopefully to policy change and so forth. I think we could adopt that model with people experiencing homelessness using their peer networks that are already so strong that become, you know, peers become family, and really using the system to support those groups of individuals to influence policy. And so, you know, here in Salt Lake, they have something called the Salt Lake Coalition to End Homelessness, and they have provider groups focused on transportation and housing and community engagement and so on and so forth. And they also have one that is on client engagement, or sorry, I can't remember exactly what they call it. I apologize, but essentially they now have a new policy that they're going to pay the individuals. And this makes me think a lot of Nick's presentation around basic income, but they pay individuals who have had experiences of homelessness to attend the coalition meetings, this one task group, to bring their voice, to have an input that the providers have, you know, access to, or getting paid to attend these meetings and so on and so forth. And so putting dollars behind people's participation and contributions, and I think is one of the best ways to have people show up, especially people who need the money, to show up and to bring their voice. And then using the privilege that those of us who have, if we have a house, if we have a home, using our privilege to support their voices getting to the right channels. So I don't know if that's exactly what you're asking, but I think there's a lot of ways in which we can think about restructuring our system to bring the voice of people to those to implement change. And even I was previously in Vancouver on the downtown east side. They have a manual on how to engage with individuals. And I forget the name of it, but I can look it up. But they have a whole document, you know, give us basic reimbursement for our contributions to your research, to the things that you're trying to do out there. You know, support us, and I think there's a lot that we can do to improve that.
Great, thank you. And while I've got you on, just a quick question from Andre, who's wondering if in Utah, are there eligibility requirements for homelessness shelters, or is any folks allowed in, and is there proof required?
Well, it's a space issue, really. And so there's not enough beds for the number of people who would need a shelter bed. And there are some, they've moved to something called a resource center model, away from a emergency shelter, where they try and bring more resources on site to individuals. In some of them, you cannot have, like men cannot, that would not be eligible to have a bed. In other ones, women would not be eligible to have a bed. So there's, and then they go through, I think a lot of places they have vulnerability assessments, and some people will hopefully go through the rapid rehousing program. Maybe they don't, enter the shelter, and so they'll go through the diversion through the rapid rehousing program. So there are certain ones, I don't know all of the exact criteria that people have.
Great, thank you. I've got a question for you, Thomas, about your typology. And I was interested in those who exit independently versus those who need institutional support. And are you aware of, or have you found any particular differences? So is there a way that we can even kind of predict who is going to be able to independently exit homelessness and who is going to require institutional support? Are there any clear differences between those two groups? And sorry, Thomas, I'm not sure if you got that question.
¿Es para mí?
Is it for
Yeah.
me? I wasn't understand that it was for me. Let me answer.
Yeah, so is there a difference between those who are able to independently exit and those who require institutional support?
Yes, there's some
Yeah, there are
factors
some
that I didn't present on this
factors,
job and this work,
in
but
the
in another
studies
studies
that
I have done,
is
there's
more quantitative, where you can
there's some
discuss some
tendencies
tendencies that we have more to have the population more representative.
there's some
There are some
factors that can
that could
facilitate
or obstacles the fact that the person is going to get out of the homeless situation. It could be associated, for example, what we see is that the person that is elder or those that has a health problem or mental problems, and they are into the system or the shelters, they are the ones who are going to have more difficulty to be independent. Something that we can see in the population that are younger, the job is more, that is a very high demand for them, so they can be independent. So they are winning a solution more from the government, because it's basically the job is related to housing. It's kind of difficult to predict the profile of the person or what answers they are going to need, because this is very global. In some studies that I have realized, this has been the tendency. I don't know if I answered the question.
Great, thank you very much. Yes, that is an excellent answer for the question. Jill, there's been a question that I think is a good fit for you, which is, well, what about providing services in the
Con respecto a proveer servicios de lo que son los...
a way to, for your context, make the hotels, more congruent with what is expected of a domestic violence shelter. So to make them safer, to make them better supported, to make them have more service on site and all those sorts of things.
Mm-hmm. That's a great question. That's certainly something that has come up, especially in media reports when hotels were first being used. Some agencies were able to secure funding to have people on site 24/7, and not just for services and supports, but actually as a security presence. However, at the end of the day, hotels are not designed to be a service center. They just aren't. They are a place to put people for a small amount of time. And it was particularly difficult prior to the vaccine mandate, when people were trying to navigate the rules around physical distancing, mask use. Those were very difficult policies to implement. I think we had a lot of information about women who felt uncomfortable wearing masks because of past trauma, for example. That would never have occurred to folks who said, just put a mask on and go in that room. It's very difficult to provide supports without, knowledge of the context of the individual who needs help. Certainly bringing service to people is a good first step. Many of these hotels were not set up to, like their kitchens were closed. They weren't set up for room service and whatnot. So it's not, and many don't have playgrounds, the pools were closed. Many of the hotels were in areas of the city that were more industrial or, business focused. So it was quite a long walk to get groceries or go to the pharmacy. Transportation was modified during the lockdown, less access. So it's really complicated. Certainly, should things move forward, we're also experiencing multiple pandemics during this pandemic. The opioid crisis has impacted service delivery as well. So it's certainly complicated, but I am encouraged by people who have been willing to lobby funders to say, give us this pool of money that you set aside for responses and let us decide how to best spend that money. So telling us it is for A, B, or C isn't necessarily helpful. For example, if you provide an emergency kit with PPE, so personal protective equipment, you wouldn't include just one size of gloves in that kit. You'd have small, medium, and large. And so I think many funders are starting to see that in order to respond appropriately and quickly, there needs to be some flexibility about how solutions are proposed and what's funded. Thank you for the question.
Great. Well, thank you very much for the answer. There was a question about for Nick about UBI and what the research says on it. Unfortunately, the pilot in Ontario that was to be providing the research on this was canceled, and that was a political decision with a change in government. So, as far as I'm aware, there hasn't been any really broad scale, really rigorous research yet. And I think that's what Nick's paper ultimately calls for is let's do it. Let's do the research now on this. So we are coming rapidly to a close on our time together. And so I just want to, again, thanks to everyone. Thanks to our editorial board for being the backbone that has allowed this journal to come into existence. Thank you to our authors for your incredible submissions, our reviewers for helping polish those submissions. Thank you to IGH for all your backbone support for this, to Western Libraries for the platform and for the technical support, and to everyone who's tuned in today for taking the time to learn with us. And I will conclude with a call. We are always open for submissions. We look forward to seeing your papers. Please, IJOH.ca, and the link has been put several times in the chat. Click the submission button, get your papers in. We look forward to reading them and reviewing them and sharing them as we are able. So everyone have a wonderful day or evening, depending where you are. Thank you for bringing this all together, and we look forward to continuing this incredible work. Have a great day, everyone.